ER doctors, what's the worst state a person has come in? Intestines laying next to them in the stretcher. Don't fall off a motorcycle and land on a guardrail. I guess technically people who arrive dead or in cardiac arrest are in worse shape, but this was the most visually terrible. My coworker said he used to work security at the hospital. Guy comes in saying he feels woozy, asks if they have a payphone. He goes over, puts the change in to make a call, and drops dead. Apparently he got shot in the head by a stray bullet and didn't know. At night doc here. Worst I ever saw was someone who had tried to commit suicide with a shotgun. Put the gun under their chin and pulled the trigger. Must have flinched at the last moment as they blew off most of their lower jaw and midface up to the nasal bone. They were conscious and trying to talk when they came in. Doctor here. Worst shape I saw in the ER was a self-inflicted gunshot wound to the head. He still had a weak pulse when he arrived, but the exit wound had half of his brain just peeking out of it. He didn't last much longer and we called the code not long after. Interestingly, the entrance wound was tiny and barely noticeable. This was one of my first trauma cases in medical school. What I remember most was that he had some of the bluest eyes I have ever seen and he seemed almost hauntingly peaceful. It makes me very sad to think of what emotional turmoil he must have been going through when he pulled the trigger, and I feel terrible for what his family must have experienced so close to the Christmas holiday as well. Eons ago during my residency, a guy came into the ER complaining of a venomous snake bite. He was also holding on to the very snake that bit him. The snake was still alive and the guy was holding the snake behind its head. He said he'd always been told to bring the animal that bit you for testing. Good times in the rural South. If we don't count dead people. I've had a shotgun wound to the elbow, suicide with a corrosive liquid, hand stuck in meat grinder. Orthopedic surgery resident. Spent a lot of time in the ED. The dude who was pushing his girlfriend's car off the freeway at night and got hit from behind may have been the worst I've seen recently. Was alive. Legs were annihilated. ER nurse here. About 2 weeks ago we had a young guy who was in an argument with his partner while off his head on drugs. Ended up stabbing himself in the chest 7 times, including once through the heart. Surgeons had to operate while he was in our department and he went into cardiac arrest twice, but we were able to bring him back. Ended up transferring him to a specialist trauma hospital, but heard that about a week later he died on intensive care. Lab scientist in hospital, so not doctor, but a few that stuck out. Diabetic patient with severe necrosis of the foot and septic, amputated shortly after arrival. The smell is something you wish you hadn't experienced. Elderly male, self-inflicted gunshot wound to the chest, tried to shoot himself in the heart, missed and then waited 3 days to come in, severely anemic from blood loss. The patient's son's reaction to hearing his dad tried to kill himself sticks with me, seeing a 40-something male breakdown. I'll never forget that one. Worst one was an accident on a farm, an irrigation unit. The massive one's about 50 feet tall, fell on a guy and absolutely crushed his femur and severed his femoral artery. I'm not joking when I say the room was covered in blood. I gave that man 10 units of blood before he was shipped to a higher care facility. All 3 lived during these visits, but I'm surprised any of them did. Former ER security guard here. I've seen a lot, but a few memorable ones. 15-year-old who attempted suicide by sticking his head in a spinning lawnmower blade and basically scalped himself. Another psych patient who anally fisted himself almost up to the elbow. Motorcycle accidents involving not wearing a helmet, med-flighted in and missing a whole load of skin. And one I still think about 17 years later, a teenage girl who coded while undergoing back alley cosmetic surgery whose dead body I pulled out of a car out front of the ED. The job is great if you're an adrenaline junkie, but also can be very sad. You need to be able to effectively cope with the stress it involves, and not everyone can do that. Not a doctor, but I think I have a story that can satisfy your needs. There was a case in Poland in 2013, where an ambulance was called to a work-related incident in a stonecutter shop. When the ambulance arrived, the paramedics were led to a man who was working a stone siding machine. He was calmly sitting on the floor, responsive and awake, only a little hazed, yet he was immediately choppered to the hospital. Report says that due to unknown issue, the machine activated when the man was doing something, unloading I believe, on its operational end, and that it trapped the man's head between moving parts. In an attempt to free himself, the man jolted back, freeing his head. but his face was left inside the machine. This man arrived in the ER with a gaping hole where his face should be, from right eyebrow through entire nose, both cheeks, to his chin. He had pieces of skull crushed and basically half of a millimeter of torn, mangled flesh covering it. His face was sent with next transport, when it was found by police, several hours later. Story has a somewhat good ending. It was based to first successful full face transplantation, with successful recovery. Paramedic here. Grossest call? Guy fell down in a hoarder house. Wife was too embarrassed to ask for help, so she fed and cleaned him on the floor. Patient laid on a dirty tile floor for 2 weeks. His right arm was so swollen and covered in maggots, the arm was as large as a leg. Removing parts of his clothes, so much tissue was already breaking down all over his body. Black and oozing pus. Man spent his last week alive in a nightmare fever dream. I've had more graphic deaths of course, but what a miserable way to die. My mom was an ER nurse and she said the worst case she ever had to deal with involved a kid whose parents had backed over them in the driveway. Apparently the toddler had the skin of their face completely pulled off where the tire had basically pinched it off of them. The kids survived, but my mom said she'll never forget the screams of that child. Not a doctor, but I'm related to an EMT who responded to a high voltage incident. Guy was trying to get something down from a power line and became part of the power line, fell 10+ foot after being electrocuted. The EMT told me the smell was like bacon. He was basically cooked inside and out. Guy was aware of what was going on and what happened, but his organs began to fail him the next day. He died after a week in the hospital and his power of attorney took him off life support a week later. My husband used to work in the ER and one of the saddest stories he's ever told me was about a little girl and her mom getting hit by a drunk driver on their way to Disneyland. The little girl was unharmed and still wearing her Minnie Mouse headband, but her mom didn't make it. We both couldn't stop crying and I still think about it from time to time. ER doc here. Had a nurse come grab me while I was charting. Doc, you need to see room 6 right now. For those of you who don't work in the ER, when one of the nurses tells you to go see a patient, you run. I take a few steps towards room 6 and the smell of rotting flesh hit me like a truck. I gagged on the spot, and this is during COVID times. I am masked. I peer through the glass doors of room 6, and noticed a well-appearing, young female. Because she looked so well, I knew I could spend an extra minute taking a quick detour to find a handful of alcohol swabs that I promptly opened and shoved in my mask to help quench the smell. I walk into the room and find this young 30-year-old female with her leg inside a trash bag, sitting next to her parents and family. They do not seem fazed by the rancid smell. Meanwhile, I hear one of our veteran ER nurses vomiting in the background. I introduce myself to everyone, and ask what brought the young lady to the ER, and why her leg was in a trash bag. She starts not by talking, but by simply removing the trash bag. And there I saw it. A 6 by 8 inch necrotic, fungating tumor protruding from her tibia. She then proceeds to explain. It started 6 months ago with a cut that wouldn't heal. It then changed to appear like a fungal skin infection. She Googled it, and was confident in the diagnosis. She decided to treat it by starving it of sugar, and going on a sugar-free, vegan diet. Eventually she convinced her whole family to do the same in order to help treat the infection, and then about a month prior to her visit today, it was too large and painful to even walk around, so she's been living in her room at home taking virtual online college courses. She added on that she's lost 30 pounds since the infection began siphoning the nutrients away from my body a few months ago. Because it grew/developed so slowly, her family and herself were completely acclimated to the smell and didn't notice anything. By this point in the conversation, I heard another nurse vomit. I then sat down and delivered the bad news, that this was not a fungal infection, and likely advanced cancer. That we would be admitting her to the hospital for further workup and surgical resection. I followed up on her inpatient testing the next week, innumerable metastatic tumors to both her lungs. I never saw the biopsy results, but my guess is melanoma versus squamous cell. Poor girl is probably dead by now if she didn't hit the lottery with immunotherapy for metastatic melanoma. Not ER but surgical staff. We got a call about a person with a large infected area but no other information besides the patient being around 500 pounds. We set up the bariatric bed, and the standard wound washout pack and wait. Anesthesia calls to say we need all hands on deck and to get peppermint oil ready. We use peppermint oil for cases where the odor will be horrible, to dab on our masks so it's no too intense. Anesthesia and patient, and a few transporters due to wait, roll into the room and a horrible smell fills the air. We ask where the wound is and the patient says wounds are all over my groin and stomach. We asks if they know how the wounds came about and response was no. Patient goes to sleep and we remove the gown and blankets to begin. The patient had 6 huge gaping wounds, 4 on stomach and 2 around groin. The wounds were green and black, which meant they've been open for a while. We start irrigating with saline and antibiotics and suddenly maggots start pouring out of the other wounds. The sight and the smell caused myself and 2 others to start vomiting. We remove some dead skin and irrigate more until the wounds are a fresh pink color and until we saw no more maggots. We pack the wounds and we set up some more procedures for the next few days to get this patient back to normalish. During the next washout, we notice more odor, worse than the day before, and it smells like dead bowel. Patient's colon was destroyed and rotting from the infection and the maggots, and so much was compromised that at that point there was nothing else we could do besides make this patient comfortable for passing. We found out after patient passed, according to the patient's mom, that patient was on insulin and refused to use new needles every time, so they used the same needle repeatedly in the same couple of spots and has been doing so for over a month before the infection started becoming noticeable and unavoidable. Mom tried to get patient to come to hospital for weeks when she noticed the smell, but patient refused until it became the mess that I described earlier. My mom is a nurse. A long time ago a lady came at her hospital. She looked like she had triplets. It's because she didn't SHT for like 1 month. She died of poisoning and was clearly mentally unstable. ER doc here. 26-year-old girl, unrestrained passenger riding with a drunk driver. Her head went into the windshield and popped the whole windshield off the car. Her skull was filleted open from the forehead up, brain completely exposed and falling out of her skull, largely intact but horribly swollen. Rest of her face and body was essentially unmarked. She was breathing on her own but not moving purposefully. She got intubated, taken to the operating room. I asked the neurosurgeon what the plan was, and he said, "I'm just gonna cut off the part that's sticking out." She had a partial lobotomy, skull was left open with the hope the swelling would go down. She was basically brain dead that night and died a week later. Driver was drunk but had a seatbelt on. Walked out of the ER that night. Med student here, graduating this year, had a guy come in who jumped in front of the subway. He was brought in with a weak pulse, but a second ambulance came in shortly after and handed me a garbage bag. I thought it was his belongings, but when I looked inside, it was the patient's right leg. Apparently his leg was trapped under the train and decision was made to do a baloney amputation in the field. It was taking too long to get the train lifted. According to the train conductor, the patient looked him straight in the eye and jumped in front as the train was pulling in. We also did recitative thoracotomy, cracked his ribs for direct access to massage the heart, but he was too far gone and we pronounced him shortly after. We had a patient who had some gangrene near a vein caused by needle use. She left the hospital against medical advice before receiving any treatment. Came back a few weeks later and her entire arm was necrotic to the point it looked mummified. She had lost use of it some time ago and was just so high it wasn't a concern until she started getting violently ill, had to amputate her shoulder, probably would have only had to do some skin grafts had she not left in the first place. Not as graphic as some of the others here, but I can't believe a person could walk around like that for so long like it was nothing. Don't do drugs, kids. Not a doctor, but I used to work for the county coroner, nights and weekends. Got a call one night, real late like 2 a.m., it was cold and foggy as hell. Call was to the country, middle of nowhere. I live in a big ag area, tons of farms and dairies and orchards. Get to the site to see emergency services everywhere. Sheriffs, fire engines, paramedics, and a giant crane. Apparently a guy who worked the farm decided to get drunk and go till a field in the middle of the night. Wound up flipping his tractor into an irrigation ditch and it smashed down on top of him. When the crane lifted the tractor clear and the floods lit up the ditch, I couldn't even tell what I was looking at. Just human meat. Not medical field, but I used to work at a foundry, and the first week they overfilled the furnace and 4 people had their feet burned off halfway up to the shins with 5,000-degree steel. You could hear them screaming across the whole facility. Unconscious 36-year-old pregnant female. Found to be a spontaneous uterine hemorrhage at 32 weeks. Emergency C-section in the ER itself. I was doing CPR on the mother while they cut the baby out and tried to suture her back up. Mom died in ICU after baby only made it 2 weeks in NICU. Left with blood on my shoes. I was the patient, not sure if I was the worst, but a piece of rebar went through my windshield and through my abdomen just under my liver a few years back while driving down the interstate. Upon walking into the lobby of the hospital, someone immediately said, "Oh my God," and I was like, "Can I check in?" Like it was some kind of hotel or something. The receptionist took her focus to the room in general and then immediately noted me specifically, then she audibly gasped once she processed what it was she was looking at, then I collapsed on the floor from internal blood loss. I remember her screaming back for a doctor, and a few moments later, a swarm of them ran out. I don't remember much past that, everything was jaded and then I lost consciousness. I'm pretty sure it was the adrenaline tapering off that caused me to deteriorate so quickly after getting into the lobby. It was a neat experience. It was also an expensive experience. EMT here, not a doc, but I've got one that sticks with me. New dialysis patient had just gotten his shunt implanted, wasn't comfortable with it, must have been fussing with it, and it came out. For those that don't know, a dialysis shunt is connected to the brachial artery, just after the aorta, so that it can pump a high volume of blood into the dialysis machine to filter it. With the shunt ripped out though, the heart was basically just pumping blood straight out of the body, so by the time we get there this guy is laying next to his couch, just empty. Pale, cool, he almost looked like wax. You would almost think Dracula had gotten to him, if not for the human body's worth of blood on the floor and walls around him. We tried CPR for the family's sake, but his heart had nothing to pump. Not a doctor, but my mother is an X-ray tech and did X-rays on my friend's father after he had been stabbed in the throat twice and he had actually walked into the police station with a slashed throat to report the assault before going to the hospital. Not a doctor, but at the time I was a stock tech for the critical care hour. Worst thing I ever saw, there was a kid who attempted suicide via shotgun to the chin, I'm guessing. The entire front half of his head was gone, including his jaw, nose, eyes, and most of his forehead. At first I was confused as to why they were bringing a body into the OR, but then I heard him gargling as they ran past. Dude was somehow still alive. I had to move on to another area of the hospital before I could find out what happened to him, but I presume he didn't make it. They were already struggling to keep his brains in his head when they brought him in, so I seriously doubt he survived for much longer. ER nurse here. Cocaine is often cut with a drug called levamisole. This causes vasculitis and eventual skin death on various parts of the body, especially the face. I took care of a lady that had this condition all over her body. She had been admitted to a burn center a couple of weeks before to treat her dying skin and sent home to recover. She was instructed to change her dressings, apply medication and given everything she needed to recover. After not doing any of these things for 2 weeks, she was brought into our ed by a concerned friend. Her wounds had all gone gangrenous and the bandages had adhered to the burns. The smell. I'll never forget it. We soaked the bandages the best we could and began removing them. She would scream, we'd push more narcotics and we'd continue on. She still screamed, but it was a little less. It took hours to get all the bandages off.